Hey, it's Dr. Chris. This is the weekly live. It's Thursday. It's a little later today. It's 12:43-ish here um, in the afternoon Mountain Time in Bozeman, Montana. And as usual, I'll be answering questions that I can find on the YouTube videos that I have posted. I'm going to answer today, starting with the video that is titled, I'm going to go up here to find it. Root canals versus extractions. All right, what would a dentist choose for themselves? So that's the video we are going to be talking about today. And I asked you guys to post questions in the video itself so I can answer them, and you did. And if you really want your question answered, just capitalize the beginning of your question and say question. And if you do that, then I'll find it quicker and I'm able to answer questions better for you. So this is going to be about root canals versus extractions. I'm going to use my personal story, my anecdotal personal story of having removed my root canal tooth up here and how it has dramatically improved my life. But there's a lot of questions out there on the process and side effects and things like that. So we're going to go through those in just a flash. When I'm reading them, I'm going to be reading them with my reading glasses. So yeah, 52. So that does happen to all of us, unfortunately. But if you're interested in these kind of broadcasts and you're interested in more Q&As from biologic dentists like myself, or if you want to learn more about becoming your best self, unlimiting your biology, becoming the alpha sapien, who you can be, then this is what this is for as well. I love answering questions about that. Now, we're going to talk a little bit about one or two patients as well per request, and I try to pick patients that I spoke to this week. Okay, actual testimonials of patients I spoke to this week, and there's been a bunch. Now, let's start with a patient testimonial. Today, just now, I left the office at 12:30, okay? This is why I usually don't work on Thursdays, but I did this week for various reasons. So today, I saw a patient, and she has been prone to generalized decay at her root surfaces, okay? So that means when you look in her mouth at the gum line, she had a lot of those little black marks, brown marks at first. It then turned into black marks, which is decay, which is breakdown of the tooth structure. And we looked at a whole bunch of different things. We had to fill them several times already. And as you know, I don't like filling fillings if I don't know what the root cause is. So we've been digging into the root cause. We'd established what we felt was the root cause about 6 months ago. All right. So this was a 6-month follow up from this um, decay problem, this generalized decay problem that just seemed to be out of control. And when I saw her today, I'm happy to report that the decay is out of control. Those black spots have actually hardened, okay? They're no longer leathery. When you use that little dental pick, we push at the root structure and see if it's hard or if it's leathery, meaning it kind of like goes in and sticks there. That means it's decay. So those black spots and the brown spots had turned hard so that you can scratch them. They no longer are pokeable and they are shiny. Shiny means that it's mineralized, okay? As every dentist knows, when you find a cavity, the tooth structure is dull. It's not shiny anymore. So that means that it's actively eroding, actively decaying. And these were now no longer shiny, which is a huge, huge plus for this person. And I didn't have to do any fillings. Like I was expecting to have to fix a bunch of those areas, but no fillings. The root surface has hardened. The brown spots have hardened. X-rays, no new lesions. The plaque in her mouth was dramatically less. Her tissue was healthy. Her acid-base balance in her mouth was balanced. So what did we do? What was the root cause of this decay? Well, it was her biome. It was the bacteria in her mouth, okay? The acid these bacteria release. So aggressive bacteria release more acid. They're like bullies. They will hog all the sugar, all the food, all the carbohydrates. They'll eat them really quick, and then they will release a very acidic byproduct. And that acidic byproduct dissolves your teeth. Okay? It sits at the gum lines and sits in the plaque, in the food particles. They live in that stuff, right? And it dissolves your teeth like that. And so what we did is we changed her biome. She happened to use Boss Biotics, the product I created back then, to see if it works. You know what? Works great. She's been using Boss Biotics twice a day, in the morning and at night after brushing, like the instructions say. And 6 months later, and nobody's perfect. She wasn't terribly consistent, but she was semi-consistent, which is good. She had seen a huge improvement. And that's why I do this, right? So she followed the Boss Biotic protocol, and she's been following as best as possible the Boss diet. That's something, there's always going to be a link, and probably in this live as well, but underneath every video, there's a link for the free Boss diet so you can understand what I'm talking about. It's a certain way to eat to feed the good guys in your mouth, which is then going to translate down to feeding the good guys in your whole body. Made a tremendous difference for her. So that was very exciting to see because, I can talk here till I'm blue in the face, and it's really the proof in the pudding that matters. And this was proof in the pudding. This really does work. So super exciting. Now, I'm going to go to the video. I'm going to scroll here to the next page, and I'm going to find the first question that I can see. And yes, I got to wear my glasses. So here we go. The video is titled Root Canal versus Extraction. What would a dentist choose for themselves? So this is kind of like my story, right? I had a root canal. I had it removed um, because I didn't want a dead organ in my body. Changed my life. There's a lot of stories that I posted in my link. I'll put another story there. This is my personal story, but I had tremendous good results from having my root canal removed. But if you have a tooth removed, because honestly, if it's a root canal versus extraction, you should probably consider extraction. So watch the video, make your own decisions. But the questions in the video are pertaining mostly to people who are in this boat. Number one, this is a day ago by Nelly9352. I'm going to summarize it. You might want to follow through here. It says, once I read that a woman who had breast cancer had a history of root canals on the same side. It goes on about, how she went to see doctors and they kind of blew her off. X-rays showed everything was normal. This lady has worked with people who've had, breasts removed because of cancer. So very sad. Sorry to hear that, but that is unfortunately quite common. So she said, I have my doubts and the annual mammal is coming up again. They don't want to do mammograms. They are wondering if there is a relationship between root canals and breast cancer. So this is a tough one, right? Is there a relationship between root canals and breast cancer? If I said there is a relationship between root canals and breast cancer, then you probably wouldn't see any more videos from me because they are very strict on what you can and can't say, right? And this is for entertainment purposes only, disclaimer. But is there a relation? If you watch the root cause documentary, you'll be able to see a whole bunch of anecdotal studies of people who've had root canals on the same side as they had breast cancer and swollen lymph glands. A lot of my patients, anecdotally speaking, come in with root canals on the same side as breast cancer and swollen glands. So, anecdotally speaking, I see a relationship. Can I prove it? Of course not. Nobody's going to do a study on this. And if they do, there's no way it's ever going to be published. Just like that inconvenient study documentary that was just released, right? The study was not released because it proved an inconvenient truth about vaccines and the health of children. They couldn't publish the story, even though they couldn't publish the actual research study because it would have destroyed the belief that vaccines are good for you. So they didn't publish it, right? But they did get the information from the person who unknowingly under a microphone was telling the truth. So you can watch that. That's a wonderful little documentary. So Will we ever get a study that proves that there is a correlation between or a relation between root canals on the same side and cancer? Probably not. Probably not, because that would destroy the root canal industry. And that's a $2.7 billion industry. That's just not going to happen. So, do I see it? Yeah, I see it all the time. I see it all the time. And there's a lot of anecdotal studies that we can't publish that say there is probably a relationship. Thermographs, right? Heat sensors that show you heat here, heat here. The heat translates. It shows you where the heat goes from the infections. So is there a relationship? I think so. Can I say there is? I can't tell you that there is, but there's anecdotal studies that show that it does. But of course, all in just good fun. It's probably not related at all. Next one. Thank you. You like the videos. I appreciate you letting me know. New subscriber, thank you. I appreciate you letting me know. And here's another question. Carolyn Bennett 4214. Is there a risk of bacterial bone infection in removing a root canal, causing permanent illness, or can it be stopped with antibiotics? Very, very good question, Carolyn. So the question is, if we remove a tooth, root canal, regular tooth, it doesn't matter, and you could get a permanent bone infection. It's called a cavitation, FDOJ, fatty degeneration, osteonecrosis of the jawbone, but we just call it a cavitation, infection in the bone. Yes, it does happen. It happens more with people who are not removing the tooth biologically, meaning they're just pulling out the tooth, closing it up, and sending you home. That doesn't work because you need to remove all the infection. You need to remove all the ligament that is around the tooth that's stuck to the walls of the bone. You need to clean, disinfect, almost sterilize that site where the tooth was. Then you have to encourage healing, okay? How do we do that? Well, as a biological dentist, what we do is we prepare the patient first. We make sure they're healthy enough to have this procedure done. If you're sick and your vitamin D3 levels are super low, you don't have the energy to fight, you don't have the biology to fight, to build, right? You don't have the diet to build, then that's not the time to take out a tooth or an infection. So we prepare you for the procedure. Number two, we remove the tooth after you've had an IV of some health boosting things like vitamin C, D3, magnesium, glutathione, whatever. We add things into your system beforehand to help you fight the infection that is going to go into your bloodstream. Okay. We can put antibiotics in the IV so it doesn't affect your biome, right? The biome is outside of the bloodstream. The bloodstream is where the infection is. You put antibiotics inside the bloodstream, you're going to prevent a lot of that biome damage. Then we remove the tooth atraumatically. We clean everything out with ozone water, ozone gas. We draw blood and create PRP, PRF, healing proteins that then we put back into the socket where the tooth was, right? And then we suture it up really nice and tight so that it doesn't get irritated and it heals well. Then we send you home and we recommend things like lymph massages, red light therapy, a certain diet, rest. I mean, there's a specific protocol to prevent bone infections, cavitations. But if you miss that window, then an antibiotic is not going to fix a bone infection because the bone has healed with a cavity inside that's filled with bad guys. Blood doesn't get inside the cavity. So the bad guys are in your bone but outside the body. That means that the immune system can't get to them. So you have this, it's almost like having a rotten tooth, but it's a piece of rotten bone inside your bone, constantly releasing toxins. Toxins that are terrible for you, really, really nasty ones, worse than botulism. And that has immune reactions, that has effects in your entire body, right? So when you have what's called a cavitation or bone infection, an antibiotic is not going to solve that. You got to go back in there, open it up, and do it correctly the second time. Yes, you may need to take antibiotics while you do this procedure, okay? And if you do that, take probiotics with it, postbiotics specifically. take your probiotics so you don't just kill the biome, you're also rebuilding it at the same time. So that's what I'd recommend. See a biologic dentist who can do a proper cavitation analysis and possibly surgery. Next question. I have to drink something or my voice will go again like last time. All right, so let's see. We have implantitis. Yes, I know that. Uh, nope, that's actually not true, but thank you for the comment. Microbiome is bacteria. That is correct. And if you're not an endodontist, you should not do root canals. That is true, in my opinion, because endodontists do better root canals, but still, they're not sterile and they still have the same problems, just not as bad. Good. All right, this was a new video. Those are the comments I see on that video. Let's go to the next video. Let's click here. Da, da, da. Down we go. People have questions about abscesses and if antibiotics help with an abscess. So let's talk about that. Here. All right, so if you have an abscess, does an antibiotic help? Now, in dentistry, when a patient has an abscess or they have like a little bubble on the side of their tooth, okay? And it doesn't always hurt, but you can see the bubble. And sometimes, when you push on it, something comes out of it, like pus. That is an infection that is on the root, most likely. It can also be in the gums, but it's mostly on the root. And that means the tooth is probably dead. It could be a dead tooth or a root canal tooth that is reabscessed. It happens all the time. So, does an antibiotic help with that? Well, temporarily, yes. An antibiotic will temporarily help control an abscess that's in the tissue because your body can attack what's in the tissue. And if you give the body an antibiotic, it's going to fight that bacteria in the tissue. And it will feel better for maybe 2 weeks. The abscess might even go away because it's pushed back into the tooth. Then the antibiotic stops, and then your body loses that weapon, and the infection goes back and it comes back into the tissue. When that happens, you see the abscess again. The abscess comes back out and it's back, and this is back and forth. People take antibiotics continuously to try to quote unquote control an infection in an abscessed tooth. It's stupid. It it destroys your microbiome. Okay, the antibiotic doesn't just destroy your microbiome, it destroys your mitochondria, your power source. You can't become an alpha human if you have no energy. If you are taking antibiotics all the time, you're killing the mitochondria. The mitochondria comes from a bacteria. It has the same processes a bacteria does. That means if you're taking something to kill bacteria and your mitochondria is a bacteria, essentially, you're going to kill your power source. And you're going to be tired and exhausted. You're going to have more fatigue. You're going to be thrown into gluconeogenesis, a different way of making energy that feeds the bad guys. It's ridiculous. So if you're taking antibiotics, especially for an abscess, that's a very temporary solution. And you should be taking probiotics at the same time. And you'll be needing to rebuild your mitochondria. That's one thing we do with the Alpha Sapien protocol. You have to rebuild them because you're killing them, right? But you need to then find the root cause of the abscess. If you don't find the root cause of the abscess, don't treat it because it's just going to destroy your body. Antibiotics is going to literally destroy your body and your energy source while you're trying to figure out what's going on. That's not medicine, okay? That's just idiocracy. So find a real doctor, dentist, naturopath, whatever it takes to figure out why you need antibiotics. And if you find the reason, sometimes antibiotics help temporarily, probiotics at the same time, rebuild your microbiome, good to go. All right, let's find the next question. Let's see, let's go back. Oh, that's interesting. New. Let's go to this one. So many people are commenting on the root canal video. I'll try to do a couple of those, okay? So once again, we're back to before getting root canal treatment. Watch this. And hopefully you did. But let's find some new comments. But sort by newest so I cannot do the old ones. All right, so there's a question here. Shreya Chandel777 asked, after a root canal treatment of upper right canine tooth, dentist suggested a zirconia tooth cap over it. They said because the patient's in the early 20s and having a horizontal crack over it, that's why the dentist suggested zirconia. But before cap procedure, they ground the tooth down. Now the patient is traumatized because she's worried about what to do in the future. Is that a good lifetime procedure? All right, Shreya. I responded, but I responded as if it was a vertical fracture. You mentioned horizontal fracture. So let's discuss those. Back we go. That's an excellent question. Number one, if you need a root canal on a front tooth, now, if, right, you don't ever really need a root canal, but if you need, or if you choose to have a root canal on a front tooth, because I understand the challenges, right? You don't want to remove a front tooth, and if you don't have a solution to it, walking around with a missing front tooth is traumatizing on its own. So sometimes a temporary long-term solution is a front tooth root canal. But a front tooth root canal, if it is not a completely broken down tooth, doesn't really need a crown. It should only need the root canal, the hole on the inside of the tooth, and then the tooth should be fine, especially when you're so young. If you start cutting down those front teeth, now you have one tooth that's a crown, which is very difficult to match to the adjacent teeth. That requires a true cosmetic dentist. And it almost seems like the art of cosmetic dentistry is dying because everything's made by computers, right? AI. And they don't look anywhere near as good as a true technician can make. But technicians are more expensive. And of course, it's a game of numbers in dentistry now. So you're probably going to have a computer make your crown. Hold on. And that's not going to look really good. Matching one front tooth is very difficult, even for a human. So, yeah, you'll be stuck with a tooth that was cut down to a little crisp, most likely, and it's not going to look great because even if it matches perfect the first day, the color will change. Your teeth will change, that tooth may change. So, it's a very difficult situation. I avoid doing single front teeth crowns or veneers almost at all costs. So, I'm not sure if this was already done for this patient, but I would advise against it. Now, a vertical fracture up and down on a front tooth is fairly normal because there's a lot of stress on teeth, okay? And a vertical fracture, or a vertical craze line as we call it, doesn't usually crack or break teeth. They can be there till you die. And that's normal. They're craze lines. I don't see a lot of craze lines in 20-year-olds. That's usually after a couple decades of chewing, right? Now, a horizontal fracture on a front tooth, unfortunately, is an entirely different story. The way your tooth is designed, the way the crystals are lined up, a vertical fracture just goes between the crystals. So kind of like taking a knife straight down a cornfield, straight down. You wouldn't even notice it. There's so many different corn cob, corn little husks that it would make no difference. But if you take a knife and you do a horizontal slash on a cornfield, they would all fall down. That's how your tooth works. Horizontal fracture, unfortunately, is very dangerous because it does damage the tooth. Now, is that fracture from an accident? Sounds like it, right? I wouldn't usually do a full crown on that tooth. I would veneer it to kind of hold it together if necessary. But I also probably would not want to do root canal. So there is a tough call there. At 20, you don't usually want to pull that tooth anyway because you're still growing and so forth. but they're getting to the 19 to 24 deadline where a root canal could be removed and an implant could be placed. You need to be fully grown for that. You could then remove that tooth, place an immediate zirconia implant, and an immediate crown on that, so you wouldn't be stuck with having a hole there for a while. It would look pretty decent from day one, and it would be a healthier long-term solution. But in your 20s, that is a tough call to make. A full cut down cap, probably not. Stay with something as minimal as possible. I would use a indirect composite material, okay, not a zirconia. Why? Because it can't be repaired. Zirconia is super hard, and yes, it is biocompatible, but if you're making a crown or veneer and you don't want to constantly spend money on new crowns or new veneers, make it out of a material that can be repaired. Indirect composite is beautiful. It can be polished, it can be shaped, it can be added to, it can be repaired, and is in general a much softer and gentler material. So I think it is the material of the future. So I would definitely go with an indirect composite, not zirconia. I hope that helps for that question. Let's go back to the next ones. Got a couple more minutes here, and then we will be done. It's just a short live today. So yeah, thank you for your information. Yeah, you're welcome. You're welcome. Do you guys do regular fillings anymore? Absolutely, we do regular fillings, um, rather than anything else because we want to be minimal and we want to find out why we need the filling in the first place. Do you guys use zirconia? Yes, we use zirconia, and many other materials. Maybe I'll go into that. It's a little complicated, but good question. So, Indestructible 8 asked, do you use zirconia or something else? Do I use zirconia? Without being getting into too much detail, it's very technical. Zirconia is the most biocompatible material we have, right? A zirconia crown is very hard, very strong. But what happens is a lab will make a zirconia crown. It'll be biocompatible. Then they will paint it with a color, or they'll glaze it with a glaze, and they'll cover the biocompatible part. So the tissue that lays up against your crown, okay, is going to be touching a glaze, is going to be touching a stain, a color, which is not biocompatible, which is more like sandpaper. So if I do a zirconia crown, I will ask the lab or do it myself. I will cut or polish away 360 degrees the polish or the stain so that the tissue is only touching highly polished zirconia. No stain, no glaze. This then allows for the strength of zirconia plus the biocompatibility of zirconia. You lose that biocompatibility if you paint it with junk. So that is zirconia. Now, over crowns, over regular teeth crowns, zirconia is a decent solution because the tooth has a built-in shock absorber. So when you bite on a tooth, it pushes down a little bit because there's a ligament around the tooth, like a sac. That sac absorbs the pressure. But if you're doing a crown on an implant doesn't have that give anymore. It's solid in the bone. Doesn't matter if it's titanium or if it's zirconia, it doesn't give anymore. So, ideally, we want to build in a shock absorber in the crown, which is going to be an indirect composite again, like I mentioned earlier. Way better option if it's possible. Not always possible if you're mixing materials, aesthetically speaking, but most certainly going to be better if you're biting on something consistently. Example, a molar, a back tooth, takes a lot of vertical force. If you have a zirconia crown or a titanium implant, and you put a zirconia crown on top of that, there is zero give. So as soon as you touch that, it's solid. Constant hitting on that will break either the crown or the implant. It doesn't matter if it's zirconium, if it's titanium, if it's, anything you could possibly imagine, it would break. So making a softer crown is better. So for Regular teeth, we use zirconia all the time. Easy, biocompatible. We can also use bonded material. You don't really bond zirconia very well. Bonded materials stick to less to structure. So if there's not a lot to hold on to, we can't use zirconia because it has to be cemented, different process than bonded. If there's not a lot to hold on to, if your tooth has a little tiny nub, we would bond. We don't bond zirconia. We would have to use something like Emax or a variety of different bondable porcelains. That gets into too much detail. So your dentist needs to understand the difference between zirconia, how to make it biocompatible, using an indirect composite, when, why, and how, and using aesthetic porcelains or soft porcelains or porcelain composite mixes. These are things that a true biological and cosmetic dentist is very familiar with, or you'll end up with, unfortunately, non biocompatible, fragile, ugly teeth. All right, let's look for the next one. Here we go. Next question would be. Hold on. I already answered that. All right, there's a question by Turtlehead420. This is a different one. It says, what can be done to save a tooth with resorption that doesn't appear to have any external cavity? All right, interesting question. A little bit advanced, but let's go through them. So, resorption. Resorption means that your tooth is resorbing either from the inside or the outside. This case, there is no external resorption, so the tooth is fine on the outside. Great. Nothing needs to be done on the outside. The inside is resorbing. I would check number one, is the tooth alive? If the tooth is alive, there's nothing you can do. The tooth is either slowly eating itself up for whatever reason we don't even know, or it's just going to be there for the rest of your life, but you can't do anything about it. If it breaks through the root and the resorption in the root goes towards the bone, at that point, it's a problem because now the tooth is literally connected to the outside and it's probably dead or dying. A root canal, sorry to say that word, sometimes can help with resorption. It would probably arrest the resorption in many cases, and you would be able to save the tooth a little bit longer if it's not too late. But if the tooth is infected and it needs a root canal, refer to the other videos and see if you really want a root canal. Anyway, if the resorption is on the outside of the tooth is going to die because at that point you're going to lose the root, and external resorption on a root is going to go and kill the tooth. So that's a removal. I hope that helps about resorption. Maybe two more questions here. And then eventually I'll figure out how to use the chat. Let's see if there was a chat option here. So, oh, there's actually a question in the chat. Let's see. Since you asked, I will try to answer. Hello. Obviously, I'm new to this. So here, if a person has periodontal disease, do you remove all the teeth and get implants, remove all infections? So let me think if I'm getting this right. Do removing all the teeth and getting implants remove all the infection? All right. All right, thank you for that question, Peace Pocket. Let me switch over here and answer that for you. Periodontal disease, bone disease, losing the bone around your teeth, okay, gum disease. That has a lot to do with your biome. So the biome has so many bad bacteria in it that it's eating up your bone, causing inflammation, and that inflammation then makes it worse, and then also eats the bone away. It's a vicious cycle. At some point, you lose so much bone around your teeth that they become loose, right? And the gums become really infected and inflamed. You can get really bad smell with that. Periodontal disease is how we lose our teeth, a lot of them. So, removing all the teeth, like you suggested, and placing some implants, does that get rid of all the infections? Well, yes, if you are removing the teeth correctly, because you don't want to create cavitations or infections in the bone. So, if it is so bad that you have to have your teeth removed, and there is many cases where that is the case, unfortunately, in periodontal disease, then removing the teeth, cleaning all the teeth out, using ozone water, using ozone gas at 20 gamma, going in there, using some red light if you need to, going in there and putting back the healing proteins, suturing everything up nicely, maybe even putting implants in at the same time, does work really, really well for the infection because periodontal disease is terrible for your entire body, right? It is clearly related to stroke, heart attacks, Alzheimer's, and so forth. You don't mess around with periodontal disease. I mean, it's an end point kind of disease. So, yes, doing it correctly removes all the infection. But think about this. Your biome is not just your mouth, right? It's your entire body. You've been swallowing trillions of those bacteria all day long. Trillions, I mean, hundreds of millions, billions of these bacteria. I mean, the numbers are so high, I don't even know. Certainly a couple billion, 100, 200, 300 billion a year, a day. Swallowing that into your gut, which has been seeding your gut with the same bad bacteria. You need to flip your biome, okay? You need to level up that biome for the entire body, not just your mouth. So that's something like a boss diet, right? The boss diet is always free. It's linked in the comments for sure. Use the boss diet to rebuild your biome. Supercharge it by using boss biotics, feeding the right bacteria with the boss diet and adding the right bacteria with the boss biotics. That would make a huge difference for you. I would try to see a biological dentist to see if you really need to have all the teeth removed. You can fix a lot of this stuff if it's not terribly, terribly awful. And I would prefer that over pulling all your teeth because in the United States, we don't have all on four or putting dentures on zirconia implants yet, as far as I know. It wasn't at least more as of recent because the FDA needs to approve certain parts for the zirconia framework to work. Haven't done that yet. In Europe, you can. So you'll be stuck with using something like titanium implants. And while they do work, and they use them routinely for all on four or doing dentures on 4 or 6 implants on top and bottom, it's not my preferred choice. Right? I want something way more biocompatible than titanium. So seeing a biologic dentist before you make this decision would be money well spent. I hope that helps a little bit. Feel free to ask more questions. I'm going to see if there's any more since I haven't even checked the chat. There you go. That was hopefully helpful for you. So if you are a subscriber, then you can comment in the chat, go to my community, and you can comment, and I usually answer those almost immediately because I want to be as helpful to you guys as possible. All right, on we go. I have a cracked tooth. I'm going to filter this real quick for newest because there's just so many. There's like 200 comments now. And I don't want to have to go through 100 comments. Good, I have a crack. Okay, I already answered that. That's not correct. So somebody said there are dead things attached to or in our bodies that don't pose an immune burden. Toe and fingernails, hair ends, everything we consume. So yeah, that is very true. That is not a dead body. That's not a dead part of you, though. So the question or the comment, I should say, was certain dead things in our body, well, they're not in our body actually, but certain dead things are around our body that don't cause problems. Hair is not in your body, hair is outside your body, okay? It's a cell that's releasing a hair follicle outside the body. The cell is in the body, but it looks like an onion and it sprouts a little hair cell. The hair cell is just collagen, it's dead. Of course, it's not in your body, it's also not an immune problem. Your fingernails, same thing. Your fingernails are not inside your body, they're simply out the body. And that's fine. The cells release the cells release the nail and it stays outside the body. Never goes inside the body. If you have an ingrown nail, that hurts, right? An ingrown nail goes inside your body where it's not supposed to be. And if you've had one before, it really hurts. Ingrown hairs also hurt, right? They didn't make it outside the body. So when something's inside your body, it is supposed to be alive. If it's dead, it's going to be a problem. So you you need to separate those. That there's no relation whatsoever with something that's outside the body and inside the body. All right. I think that is about all the time I have today for the live. Now, if you want to have your questions answered, either become a subscriber down here, click on the subscribe button or like the video, and then you can comment in the community. If you do that, you can also comment in the live and I'll answer your question. You can also ask questions to me directly, which might be a very big benefit to you. Let me know what you want to hear about. Let me know what you're interested in with regards to videos, and I'll do my absolute best to give you an unbiased biological opinion. Have an awesome day.